We'd like to welcome you to our regular convening with the media to discuss our ongoing efforts around the pandemic associated with the coronavirus. And we're happy now to entertain your questions. I believe that you will receive instructions from someone else about how this is going to operate, but please be patient with us. This is the first time we have done this, and we're trying to make this more accessible to you. Thank you for your participation.
So we're going to all make opening remarks?
Yes, would you all please make opening remarks?
Yeah, Bert Show with the Health Department. I want to thank everybody in the community for all their hard work, all their attention to detail, taking this very seriously as we move to our next phase. And it's our team at the Health Department who we've worked with together and the team within the community trying to make everyone safer as we move forward.
The last few weeks, the principals of the Unified Demand come before you in order to answer questions of the media. We've encouraged the guidelines of the UDC, follow the guidelines of the Mobile County Health Department, follow the guidelines of the governor. And we're here again to really do the same thing today, except I'd like to add a kind of a different twist to that. And this may be directed more at those who are younger than what we know to be susceptible age, and that's those the most vulnerable right now are, some say, 60 years and older, although there are some cases younger than that. But you need to be thinking about the future. And what we know in the city of Mobile is that if you think about past health department studies, we suffer from obesity, we suffer from hypertension, we suffer from diabetes, probably higher than what the state and the national norm is. And so if you think about the corresponding number of deaths and cases that we have currently, are the two connected? And I'm not going to make that, I'll let the health department make that connection, but I do want to encourage those that maybe have a history of the hypertension or heart disease in their family. You need to start doing something today to think about your future, because we don't know how long this virus may be with us. So whether it's starting to eat healthier, whether it's starting to change your diet, which is eating healthier, or whether it's to start exercising, those are things that we can all do. So my challenge to myself and to everybody is, let's unite in trying to determine and making our mind up that we're going to start fighting this thing now, even though we are not in that age group that may be the most vulnerable. So anyway, I appreciate you thinking about that, because it will help you in the long run, whether there's a COVID virus or not.
Our Q&A is now open. Our first questions come from AL.com.
My question, county statistics now show that COVID-19, again, has overwhelmingly targeted people that are 65 and up, with more than 90% of those people suffering from underlying health conditions. Just a question again, following up on what the mayor said, what does that mean moving forward from a health and economic standpoint? Questions both for Dr. Eichel and Mayor Stimson.
Because of my remarks that I made, but the cases being primarily 65 or 60 and 65 and older, what did we think that the economic impact, how those two may be tied together is how I heard it. Okay. So, obviously, when we think about the age group that's my age and Sarah's age and Dr. Eichel's age, we're all in that age bracket. And whereas maybe a decade ago, there were a lot of people retiring at 60, 65 years old, a lot more of us are working, up to age 70. And so, whereas I would say that because of that we're still gainfully employed, that age group is still very much in the mix of what goes on in our community. And so everybody that gets sick from the COVID virus, especially those that succumb, that is creating a void in the matrix of economic prosperity for our community. And so I would say that it has a direct impact on it. That's how I would answer the question.
Yes, and I agree that the economic impact is tremendous. The health impacts are really the group that 62% of the people age less than 64 to age 25 are infected with COVID-19. It does have a predominance for people over the age of 50 to have a very bad outcome. So the disease data is impacting a significant number of people, but the worst negative impact is in people over the age of 50, and many of those are gainfully employed and doing very, very important jobs in their community and very, very important to their families.
Do you have any other questions, AL.com?
Yes, I'd like to follow up with Dr. Aisho and just a reaction to the mayor's comments earlier in regards to potential obesity, hypertension being an issue in Mobile County versus other counties in the state.
Well, the question was about hypertension, diabetes in our county. Those are both chronic diseases which affect a tremendous number of people in Alabama. According to the Robert Wood Johnson Foundation survey, there's a very high preponderance of those two diseases along with obesity in Alabama, and they negatively impact a person regardless really what illness they get, but particularly with COVID-19, they seem to make the disease course more challenging.
Is there another question?
Yes, one final question. Earlier today, the White House released a report. I don't know if you've received or reviewed that yet, listing Mobile County as among the stable counties in which it highlighted, saying something like 270 new cases in the past 7 days. I don't know if anybody's has seen that report or had any reaction to it.
I have not seen the report, and I'm surprised that the White House has picked up the cases in Mobile County, but I'm glad that they're paying attention. There are some other things we'd like for them to look at.
Okay, the next set of questions will come from WKRG TV5.
Hi, everyone. Our first question for you all is, can you confirm the COVID-19 numbers in public housing and kind of just talk about public housing and COVID-19?
I'm aware of that there's an increased number of COVID-19 in some of the public housing. I've talked to Mr. Michael Pierce, who's head of the Mobile Housing Board, and we're working with Franklin Primary Healthcare to do the testing in some of those housing units. And we've actually provided masks for the residents as they're going forward. But there are some issues, but I cannot tell you exactly what those numbers are at this time.
Next question.
My second question is, with such a large fire happening in Mobile County yesterday, burning at least 230 to 40 acres, that's just last night, what advice do you have for people who may need to evacuate their home amid a pandemic?
Well, actually, we have under discussions with Mobile County EMA. We're soon to begin hurricane season. So I think that would apply the same kind of situation if it were a large number of people. Historically, the Red Cross has stepped in if individuals needed to leave their homes under isolated conditions and help find housing for them. But as far as a mass shelter, we would plan to open up a mass care shelter of some sort, just if it like a hurricane. But we have to use extra precautions now for the 6-foot spacing, take temperatures as people who come into the facility, and then we need to isolate COVID-19 or somebody who actually has COVID-19. And those details are being worked out. Actually, we had a conversation today with EMA.
Your last question?
Okay, last question. We've heard that there could be a resurgence of cases once things open back up. Stuff kind of started opening up a little bit more on Monday of this week. How long is it going to be for us to find out if that happens here?
I will tell you, as in public health, we're going to continue to monitoring. We've had tremendous increase of testing capacity, and we're going to monitor closely the number of cases. We have a trend right now that's relatively flat. Unfortunately, hadn't been going down consistently for 14 days as the White House and CDC had outlined, but we are in about a 3-day decline in cases right now. And so we're optimistic that if people will do the social distancing, wash their hands, and wear face covering, that we will have limited increase in disease activity.
Can I follow up with
Sure.
that? So when you think about the opening up, let's say it really started probably Tuesday. So if you started Tuesday, typically, was it 5 days, 8 days, 10 days that we may start seeing a bump up from that? What would it be?
It can start 3 days and go as late as 10 days. That's why when people go into quarantine, the 10-day is the number that we look for. So there will be a lag period, and that's one of the challenges with COVID-19 is the lag period, and some people are asymptomatic who may feel perfectly healthy, but may be early carriers of the virus.
Thank you, Channel 5. We will now have the Lagniappe.
All right. I wanted to know what sort of information are the three entities sharing with one another, and anybody can answer it.
First off, there's statistical information that we're sharing. The city is sharing financial information. We're sharing information from our individual meetings that we may have with user groups like the restaurants. And so I think that as far as I can tell, we're sharing everything that was pertinent to us each having to do our job at this point in time.
Okay.
I don't know anything that we're really missing.
We're actually on joint phone calls with our constituents and trying to work together. So if they have a question for public health in the food and lodging business, they can refer to Dr. Stephanie Crawford, who has been on the calls with the city representatives.
In addition to the three of us, we are also sharing with the other municipalities inside Mobile County, because what we are trying to do is make sure that all 11 have the same amount, the same information, and able to respond in the same way. So it goes just beyond the city of Mobile to all of the county, all of Mobile County.
Okay. Do you think mass testing would ever be a possibility in our community?
We're increasing capacity on a regular basis, and when you have mass testing, as they did in South Korea, they tested almost everybody in the population over a relatively short period of time and then retested everyone again. I don't see that happening right now, but it would be, there's devices coming online, and so I would say in the future, but I can't tell you when in the future that's going to occur.
And last question, does anybody at the table believe that we will have a second outbreak in the fall and winter? And if so, how bad would it have to be for us to consider closing everything down again?
I will say is that if history has a tendency to repeat itself and novel viruses is what we're dealing with, I think we need to all be very cautious. If we really take this seriously and maintain the preventive measures, that I think the likelihood of having a second wave would be significantly reduced. But social behavior, it goes from person to person, is going to dictate that. And I commend everybody in the community for responding as they have to the public health message. We have never exceeded our capacity at our hospitals or intensive care units, And that was one of the major goals as we started forward. But the virus is still there. I hope we'll have a vaccine. Will it be seasonally influenced and have a decrease in it, and or what happened? Somebody had to bring the virus into the community, and so until we have a vaccine, we're still vulnerable.
Thank you, Lanya. Now we'll have questions from WPMI TV 15.
Thank you. I've got two questions on different topics. First one, talking about the guidelines for returning to work, quarantine. Dr. Murphy spoke, I think it was yesterday, on time-based and test-based, the new guidelines. To my understanding, we're still under the Safer at Home order, which states an affected person shall be quarantined for 14 days after testing positive. What's your advice for employers and people that there seems to be some confusion or some different guidelines coming out?
The question about guidelines, if you're COVID-19 positive, stay at home until you're without symptoms for 3 days, and then you can return to the workplace. The employer could ask the employee to bring a note from their doctor if they felt that was indicated, but we will work with individuals on a case-by-case basis. We have a team, we'll answer phone calls, we can talk about it, we can talk to employers. And the guidelines with the CDC change as we've seen over time with testing criteria when we first got started. So I'd say right now is that we will be glad to answer questions on an individual basis, but what CDC has published, the employer should follow. And again, I would encourage any employee who doesn't feel well or has cough, shortness of breath, the symptoms we've talked about, to please call your employer, call your physician, call Franklin Primary Health Care, call the Mobile County Health Department, Family Health, and let's get you tested. We have capacity, but we don't want anybody to go in and unnecessarily expose someone else to COVID-19.
Next question.
Going to the underlying conditions, reported 94% of the deaths had underlying conditions, and y'all spoken about a little bit, but what percentage of the general population would be considered to have an underlying condition?
About 30% would be the general rule that we feel in health is what the average population has. As the mayor pointed out, we all have opportunities to improve our lifestyles, but people who have hypertension, diabetes, and heart disease, lung disease, things of that sort, but about 30% of the population, maybe a little more in Mobile.
And your last question.
That was all I had. Thank you.
Thank you. We will now have questions from WALA Fox 10.
Yeah, I want to make sure. Are you able to hear me this time around?
Yes.
Okay. Two questions. Dr. Eichholt, to what extent are we making any progress in the congregate settings? Talk about, it's hard to see the forest for the trees. Some days you go up 40, some days you go up 20, you go up another 30 again. What are we doing? Kind of give us an overview. Community transmission, is it congregate settings? Is it everything? Give us the scope on that.
Well, the data will show that long-term care facilities and their employees represent about 24.5% of the disease impact in our community. 62% is probably community transmission. That varies from person to person. There are some places where people are getting a little too close. There's some places that we can't find a single behavior that is causing the problem. But again, it's person to person And that's why the 6-foot distancing, sometimes we've talked about before in our unified command briefings, is go to the grocery store for somebody and bring them back their groceries. Don't put the other person in your car because you could be less than 6 feet apart from them, and then take them to the grocery store are kind of things that we really need to stress. But overall, the community is really doing well. And I have to just commend everybody for taking it seriously. We can do a little better, but we don't want to have the numbers go back up.
Can we please have closing remarks?
Well, I would just like to say thank you to the community and everyone. Thank all of our doctors, our hospitals, the medical care teams. 15% of the people who tested positive for COVID-19 are healthcare workers. They're going the extra mile to help take care of each and every one of us, and we really appreciate their hard work, dedication to what they're doing. The hospital leadership, administrators, the chief medical officers, but more importantly, every single person who lives in Mobile, Alabama, for taking it seriously and having personal responsibility. Don't share this virus with anybody else. Don't share it with your family members, and don't get it yourself. So a lot of hard work, a lot of good, very good people. It's been hard economically, I know, but the health and well-being of the community is both in the personal health and in the economic health. And working together as a unified command, I think we're sensitive to all issues.
I'd like to echo Dr. Aisho's comments about really thanking the people who are taking this seriously, who are wearing your face coverings and walking 6 feet apart and trying to do that part. But we can do better. And for those of you who, for whatever reason, have decided that you don't want to wear a mask when you're out doing your retail shopping or among other people, we just ask that you reconsider that decision, because this reopening is really a test. And we're hoping that at the end of this, that our behavior will rise to a level where we're able to continue to reopen as opposed to having to retrench because we have a disease recurrence that happens. We'd also like to just bring to your attention that remind you that on July 14th, there is a runoff election that was changed from March 31st to July 14th. We're encouraging those who would to vote by absentee ballot. It has been made a little simpler now. Not wanting to expose yourself to COVID is an allowable reason under the illness category for absentee ballots. All you need to do is just call. You can call 574-6400, 574-6400, and they will mail you your absentee ballot application. You complete your application and mail it back, and then they will mail you your ballot. And all of this you need to complete all of this by July 9th so that your ballot can be in place to be counted on July 14th. If you have any additional questions, call probate court or just call 574-6400. And the sooner you do it, the better. I know it feels like it's a distance away, but because they may have a higher subscription of people using absentee ballots, the sooner you get it in, the better.
Very good. So yesterday I had the opportunity to go get a haircut, which was badly needed. And yesterday and today at lunch, I had the opportunity to go eat at one of the restaurants downtown. And I noticed there was social distancing. All the rules that had been asked, or the guidelines of people wearing their face coverings, was being adhered to. And so I'm very, very hopeful that we will continue to do, as Commissioner Ludgood said, is that we will ace this test. We will continue to do a better job, with the social distancing, the wearing of the face mask, the personal hygiene. And it's amazing at the number of people that I've seen on the sidewalks walking, riding bicycles and all. And I sense there's some excitement in the community right now because of all the close contact businesses that have been able to go back to work and lifted that burden off of all of those families. But as we say every week, the virus is still out there. Let's do not drop our guard. You know, let's just stand. We can't stand shoulder to shoulder as we go through this, but let's make sure that we stand together or stay apart so that we can win this. Thank you very much.